Good afternoon. I am Maram Sulaiman from Faculty of Pharmacy. Today I'm going to talk about anidulafungin, Icalta, and we're going to start now. The dosage form and strength that exists in Jordan is Icalta, and it's 100 mg per vial. So about the indications, it's indicated for candidemia, or intraabdominal or peritoneal candidiasis, and the treatment of candidemia and other forms of candida infections like intraabdominal abscess or peritonitis in adults and pediatric patients of age above the 1 month of age. Okay. So regarding the doses in pediatrics, it's recommended the dosage for pediatric patients aged 1 month to 18 years old, 3 milligram per kilogram loading dose in day 1, and followed by 1.5 milligram per kilogram daily as maintenance dose. About the pharmacokinetics and pharmacodynamics, the concentration and exposure in children were similar to those observed in adults. The protein bindings was high, like above the 99%, and the half-life elimination was 14 to 50 hours. And about the excretion, it was excreted in feces like 13% and 10% as unchanged drug. And in urine, it was less than 1%. Okay, so about the metabolism, there was no hepatic metabolism observed, and it undergoes slow chemical hydrolysis to open ring peptide lacking antifungal activity. This drug have a good advantage, like it doesn't require dosage adjustment if patient have a hepatic insufficiency or renal insufficiency, but it needs progressive monitoring in hepatic impairment if there was increased transaminase enzymes, if it was noticed. About the monitoring parameters, we need to monitor the liver function test, and we need anaphylaxis or infusion reactions, as any antifungal or antimicrobial drugs. It can cause bronchospasm, dyspnea, or flushing, or hypotension, or pruritus, or rash, or urticaria. And we need, of course, to assess the effectiveness of treatment. For the administration, it can be administered only by IV, and the infusion rate should not exceed 1.1 milligram per minute, or maybe 1.4 milliliter per minute, or 84 milliliter per hour. The only diluents we can use is dextrose 5% or normal saline. Now the most important, according to the preparation of administration, we need an adult aseptically to add 15 milliliter if used 15 milligram vial. It's not available here, or 13 milliliter if used mid-milligram vial, which is available, of sterile water for injection to each vial. Further dilute 15 or 100 milligram vials in 15 or 100 milliliter, respectively, of only dextrose or normal saline of concentration of 0.77 milligram per milliliter for the final infusion solution. Do not dilute with other solutions. According to the side effects, we can see hypotension, hypertension, and peripheral edema, insomnia, and hypokalemia, hypomagnesemia, and nausea and diarrhea, vomiting, UTI, increased serum of alkaline phosphatase, and bacteremia or dyspnea or fever. An important side effect in post-marketing or case report was reported, a rare occurrence of ECG changes, or including prolongation of QT interval. Until more information and details is obtained, the patient is not taking any additional medication which prolongs the QT interval. No need to monitor, but if our patient is taking a drug that prolongs QT interval, it would be contraindicated. But if there is no another drug, there's no reason to require special precaution with the use of a vasoconstrictor. We should be cautious in concomitant use of fluorotil. And now we get specific issues according to the dosage form. Like fructose, it may precipitate a metabolic crisis like life-threatening hepatic failure and hypoglycemia and hypophosphatemia, lactic acidosis. It was noticed in patients with hereditary fructose intolerance, so we should take a careful history from patient with hereditary fructose intolerance. Okay. And we got a polysorbate 18. It causes hypersensitivity reactions, like usually a delayed reaction. It's have been reported following exposure to a pharmaceutical products containing polysorbate 18 in certain individuals. Like it caused thrombocytopenia, ascites, and polymerase deterioration. And renal and hepatic failure have been reported in premature neonates after receiving parenteral products containing polysorbate 18. And lastly, the precautions. Do not concurrently infuse with other medications or electrolytes. And we should seek immediate treatment for hypersensitivity reactions and discontinue treatment immediately if reaction occurs, like to avoid anaphylaxis or other things. And thank you for listening to our in-service. Information was taken from Lexi.